Let me just very quickly introduce our very august panel. We have Minister of Finance for Indonesia, Minister Sri Mulyani. We have Tim Evans, who is our Senior Director of Health. You already know Guang Chen, who just presented. We have Ms. Bella Bird, who is Country Director for a number of countries, Tanzania, Malawi, Burundi, and Somalia. And we have Rashid Ben Masood, who is our Country Director for Nigeria. And last but not the least, we have Minister Aishatu Bulama Kane, who is our Minister for Planning in Niger. I also just wanted to say that we have two of our panelists having to leave earlier, so we're very fortunate to have them here. But I'm going to start with you, Minister. And I'm going to just ask you a couple of questions that actually arise from the presentations earlier. We know that in Indonesia you are putting a great deal of effort as far as stunting is concerned. We also know that you have a very solid decentralization reform program that has been ongoing over the years. Now, decentralization gives us challenges as well as opportunities. Could you talk a little bit about the kinds of challenges you face in a country as diverse as yours in actually moving the stunting agenda across sectors? So we're talking across sectors, but also across tiers of government.
Thank you very much. Just to give you an idea, the Indonesia, 257 countries in this case, and 10 million children is stunted, and we are actually working through many of the channels of the policy. You're right, telling about the Indonesia, we have more than 350 districts, and the structure of the government then is complicate the way we are going to deal with the issue like stunting, which according to three speakers previously will require across the board coordination between the ministries at the central level and between the central level and the local government. So how the government is going to address this issue? First, the political commitment of the president and the vice president, which is very strong. They really want to address this issue in an effective way, and they've already articulating in many events, inviting both the ministerial as well as the governor to make sure that they are going to pay attention. The second challenge is actually how to translate this political commitment into an effective program. And that is a combination, as Huang mentioned, from the Minister of Public Affairs, Public Work, then the issue about construction or water sanitation is becoming very important. And this is from the central government, while at the same time, the issue of health has been delegated to the local level. The health ministry is definitely have a program, for example, directly to nutrition by providing a nutrition. We are talking about the primary health care, which is going to then monitor the family, especially poor family, which is actually having a baby or children, the first 100 days of their life to be an attention. But what is most difficult is actually how we are going to motivate local government, which is really directly dealing with the people. This is especially at the district level. And the government of Indonesia is now trying to use first the fiscal instrument, because we have a fiscal transfer to the local government. General transfer maybe is not really can be linked to this performance base or changing the behavior or motivation, but the special transfer can actually design, and we start now introducing the stunting in first, for example, on allocation of the village fund. We are going to put the village fund in which on the formula of allocation will be put the stunting as one of the variable or criteria to transfer. That's also at the district level, which is higher than the village. We are going to put not only the special allocation, which is related to the stunting, that's including on the water. And then of course, we are having the special transfer, which is related to the infrastructure. Now, other thing which may be away from what you're thinking related to stunting is a lot of the water, and we're talking about water. Water has been produced and managed by the local water corporation, which is owned by the local government, and usually they don't perform really well. both from the financial as well as the governance. So in Ministry of Finance role is important. We are trying to clean up their balance sheet from the bad debt in the past. But also local government, local water company is also very sensitive with the pricing issue. Usually the price of water is politically very sensitive. Many local government want to be popular, and that's why they are actually selling or putting the price which is below their cost, and that make the company bleeding. So the issue here is actually how we are going to put the good governance, rise a price strategy, and sometimes local government has not enough capital, so they want to invite private sector participation on this water production company. And that is something that Minister of Finance assisting local government in terms of the pricing, subsidizing the price in this case, and putting the right incentive on the corporation so that they are going to be able to still mobilize capital from the private sector, but at the same time have the ability in a sustainable way producing a clean water. That is the area which we are working now. So in short, I'm saying that dealing with the stunting is not only talking about identifying who's the targeted population, but in terms of what kind of intervention across government, central level as well as the local level. And we use as much as possible the fiscal policy in order for us to be able to change the behavior of both technical minister like health and public work with the local government also. And we even explicitly provide incentive using a special transfer or formula in which putting stunting as a criteria to get the fund. And then of course, the corporate governance related to the water company at the local level is also very important. Thank you.
Thank you very much. Thank you very much, Minister. Tim, moving to you, Minister talked a bit about the ways in which these different parts actually come together. Looking at it from a health sector perspective and looking at it from a multilateral development bank health sector perspective, what are the kinds of things you can do or have done to actually put this issue of stunting, which is considered to be sort of belong to the health sector, as being part of a broader policy agenda, not just in water, but in infrastructure, in construction?
Great. Well, first, we're for every problem we can't solve, we're delighted to share it with other practices and have them take the lead. And I think this is an excellent example. But I have to say that when we look at this issue, we have to look at the evidence and look at the time trends and with honesty and humility say, we haven't done terribly well. And if we look at some of our other sentinel indicators of performance, child mortality, the world has witnessed the fastest declines ever recorded in child mortality in the last 30 years. And nutrition, measured by declines in stunting, has lagged behind. So improvements in survival are 2 to 3 times greater everywhere than they are in nutrition. And so the question is, this has been a very surprising and humbling event for us because we would have thought, well, nutrition is a pathway to better survival, and therefore we should have seen at least a similar rate of improvement or close or even better, and we haven't. And so I think this has led a lot of us, the broader community, to ask, well, what's going on? And I think then some of the studies that have looked at the associations have revealed some humbling evidence. One in particular, in health, we invented something called a randomized control trial, which is our gold standard evidence. And when we looked at 14 interventions in water and sanitation to improve nutrition, the impact, the effect of intervention effectiveness in terms of improved nutrition was not nearly as strong as we would have expected. Okay, so we looked and said, well, what's going on here? One of the World Bank Group economists did a fantastic analysis across different countries and showed that, in fact, there isn't any single intervention that's necessary. And this reinforces Guang's point that there are at least 4 different types of interventions related to agriculture, food security, good feeding practices for young children, healthcare, as well as environmental change. And I think what we're realizing is that how we bring those together in ways that we achieve greater interventional effectiveness in terms of nutrition outcomes is where we have to learn to do better. And I thought the slide that Guang showed, which is intervention effectiveness for nutrition in WASH, is not having a water pipe with water coming out. It's having a water pipe with clean water coming out that falls below the level of acceptable pathogens in the water, right? And that's an extremely important difference in the quantity of interest that we want to measure as effective outcomes. So on the basis of that sort of sober reflection, I want to say 3 things that I think are absolutely critical. I think, first of all, weighing in on WASH is absolutely fundamental. And so if we can identify nutrition targets associated with WASH interventions, I think this is an incredibly important advocacy tool. We can move towards our nutrition targets by more effectively investing in WASH. And we need to make that clear, not here, but in the UN and everywhere, because it's not just us in the health sector. The second is we've got to really recalibrate the scales. And this is by saying we can move towards more effective interventions in WASH that will be more nutrition effective. And so ideas of targeting the first 1,000 days, something we call baby WASH, targeting the most at need populations are absolutely critical. And I think if we measure the relative improvement in effectiveness on those interventions, then we're going to be even more effective. Last thing is I think we need to think about achieving new heights in where we're going. And in that regard, the measure of effective coverage is absolutely important. If anybody hasn't read an article by Tanahashi in 1978 in the Bulletin of the World Health Organization, you should. Because it isn't specific to health. It covers everything we do in implementation effectiveness. And it says, how do we get that outcome measure of interest, which is clean water consumption, right, for every child and every household versus access to a volume of water, right? That, I think, is absolutely important. But secondly, is if we can move in that direction, how are we going to finance this as a development institution? What is the financing calculus which is going to show us that at local, regional, and global level, development finance is actually catalyzing the changes in domestic resources that we know will not only get us to the targets, but will sustain us. And I think on that front, we've got a lot of collective work to do, but I think the opportunity of us coming together and doing that as a World Bank group is really the one that is so exciting for us at this point in time.
Thank you. Thank you very much, Tim. Madam Minister, if I could turn to you. We know that in Niger you have been really giving a big push to the stunting agenda because of the widespread nature of the incidence of stunting in the country. I'm going to ask you a question quite similar to the one I asked Tim, and that is, how do you make sure that different departments that are, or ministries that are linked to the broader stunting agenda, how do you make sure that they actually recognize their role, and what have you done in that regard?
Ça marche?
Does it work?
Bonjour.
Yes. Good morning.
Donc, je voudrais vous remercier
Well,
pour
thank
m'avoir
you.
invité à ce
Thank you
panel.
for having invited me to
Je
speak
voudrais
on
aussi
this panel.
saluer
I would
l'initiative
also like to pay tribute to
de la Banque
the
mondiale,
World
je pense,
Bank
qui
Group
nous a
initiative,
été présentée
the
par
initiative
monsieur,
that was
qui met
presented earlier
le
on,
doigt sur des
that
problèmes
really
et qui
hits the
nous
mark
interpelle,
in
nous,
terms of the
les
problems that
politiques,
we have and
nous, les gouvernements.
speaks to us as
Et
politicians,
c'est vrai que nous
speaks to
faisons
us
de
as
belles
governments.
politiques, nous
And it's
faisons de
true
beaux
that we
programmes,
outline
nous
these
mettons en place de belles
programs
stratégies.
with lovely
Mais
strategies
cette
that we
façon
try to instate,
de-
but that way of talking about
d'appréhender
it, that
cette question,
way of dealing with the
nous
problem
interpelle.
is
Et
one that
je
speaks very
pense que
directly
les
to
leçons
us.
qui
And I
ont
think
été
that the
tirées
lessons learned
de
from
ce qui nous a été
from what
présenté
was
ici
presented
sont
this
très
morning
parlantes.
are
Et elles mettent le
particularly
doigt sur le
evocative.
problème.
And they really hit
Nous,
at
au
the
Niger,
heart
nous
of the
sommes un
problem.
pays qui
In
est
Niger,
à 45% de
well,
taux
it's
de
a country
pauvreté.
that has a
et
45%
principalement en zone
poverty
rurale.
rate, notably in the rural areas.
Plus de 40%
More
de
than
notre produit intérieur brut
40%
est issu, je veux dire, est le fruit du travail de 80% de la population, le secteur rural.
more than
Et voilà que c'est dans ce secteur que tous les problèmes de
our
EAH
problems
se posent.
arise in
Et nous,
the
dans le cadre de notre plan de
agricultural
développement
rural
économique et social
areas.
que nous
And in
venons
the
d'adopter,
context of our
nous disons
PDES, our
qu'il
plan
faudrait que
for
nous fassions
economic
de
and
la
social
transformation
development,
du
we
monde rural
really
le
focus
pilier de
on
l'accélération de notre
overhauling
croissance.
the agricultural sector. That's
avec
got
les
to be
résultats
a
que
foundation
nous venons
for
de
our
voir de
growth.
ces,
And when you look at the
cette
results
étude
that were
dont
outlined
nous
in the
avons
studies
la partie
that you've
nigérienne, parce que le
presented,
Niger
and you
fait
have
partie, nous sommes
the
très
Niger is included in that.
interpellés, très alertés.
It's
Effectivement,
a
madame,
real
votre question
warning
est importante.
alert. And
C'est
it's
vrai,
true,
au
your
Niger,
question is very important.
ces questions,
In
nous les
Niger,
avons prises en charge en mettant en place ce
What
que nous
we've
appelons
done
un cadre de concertation
is set up a
pour
consultation
ce qui concerne
framework
tous
in
les
terms
intervenants
of
dans le
bringing to
secteur
bear all
de
the
l'hydraulique et
different
de
sectors
l'assainissement.
that work with
Mais
water
l'étude
hygiene and
a fait
sanitation.
ressortir qu'il y a quand
But
même
the
des
study
problèmes.
that we carried out showed the
C'est
problems
vrai,
and highlighted
en tant
the
que ministre du
areas
plan, je
where
fais
there are
partie de
still
ce cadre de
shortcomings.
ce
Now,
contrat. Le
I'm
ministre
part of that
du budget fait partie.
consultation
Mais
with the
il y a
Ministry
aussi
of Minister of
l'agriculture,
Budgets,
l'élevage,
but you've
la
also got
santé, l'éducation,
livestock,
etc.
you've got
Ça
health,
veut dire
you've
que
got
ce
education, you've
problème
got
n'est pas un
infrastructure
problème
that has to come
d'eau
and
et
play a
d'assainissement
role. So it
seulement,
means it's not
mais
just a
un
problem to do
problème
with water and
véritablement
sanitation.
multisectoriel.
It's a really
Il se trouve qu'au
across
Niger,
the
donc
board
aujourd'hui,
issue.
dans la situation
And in
actuelle,
Niger, in the
vous
current
avez 7
circumstances that
ministères qui
we're in,
prennent
you
en
have
charge cette
7
question.
ministries
Et
that are
cette question a
tackling this
été,
head on.
je veux dire, transférée
I
aux
would
régions.
say that
Et
this
donc,
has
vous avez
also
8
been
régions.
devolved down to the
Transféré aux
different
collectivités,
regions.
je
We have
dirais.
8 regions
Vous avez
with different local
266 communes.
authorities. There are 260
Donc, vous avez
communes in
266
these
communes,
different
8 régions,
regions,
7 ministères.
260
Effectivement,
communes,
il faut
8
une
regions,
véritable
7
coordination.
ministries. And
Une
it's true
coordination
that you have to
intersectorielle.
ensure
Et
intersectorial
c'est ce à
coordination
quoi
amongst
on
all these
s'attelle.
different
Et c'est
entities.
pourquoi,
And that's what
dans
we're
le
trying to
cadre de
do.
notre
And that is
PDS que nous
why
allons présenter
in the
bientôt au cours d'une
PDES, our
table ronde
plan that we're going
à
to
Paris,
introduce
nous
and
avons
present in
mis
a
en place
forthcoming
un système,
roundtable in
un
Paris,
mécanisme qui puisse
we
permettre
set up
ce qu'on appelle
a
des pôles.
mechanism
Nous avons mis en
which
place des pôles qui nous permettent de
has
suivre
enabled us to determine
par
various
secteur,
hubs
par
by
secteur,
which
je
we'll
dirais.
be
Quand on
able
dit
to
secteur, nous
monitor
maintenant,
what's
on raisonne plus
happening
en
in the
secteur
different
ministériel,
sectors. And actually, I'm
mais
not
en
talking
secteur
about ministerial
en secteur
silos. I'm talking about sectors
rural,
like the
en
water
secteur
sector, the rural sector,
transition démographique, etc.
the demographic
Donc, pour ce qui
transition
concerne ce
sector.
pôle
So in terms of
spécifique,
that
il
particular
s'agit
water hub,
de se donner des objectifs
what we're trying
d'ici
to do is give ourselves
2021
specific
et
targets
s'organiser
for
à travers ces
2021,
pôles
and then we
qui
can
vont
work
intéresser non seulement
through these
le niveau
hubs,
central que le niveau,
because these hubs will go
et le niveau
across the
décentralisé, comme l'a
vertical
dit
level, so
d'ailleurs
top
Madame la
down,
ministre. Donc,
as
que
well as being
ces
devolved
secteurs
across the different
puissent
regions.
s'organiser
And
afin
so
que
the idea is
tous les
that
3
all
mois,
of these different
nous nous
sectors
organisions
can
pour vérifier si nous
ensure
sommes
that
en
every
train
3 months we can
d'atteindre les cibles que nous avons fixées.
see if we're on
Nous sommes,
track with our
ce que
objectives.
cette étude a démontré,
That survey
c'est que si nous
has
voulons
really
véritablement
demonstrated the
adresser
fact that
la
if we
question de la
really
lutte
want to
contre la
tackle the
pauvreté,
issue
il
of
faudrait
the
que la
fight
question
against
de l'eau,
poverty, then you
l'assainissement,
have to
hygiène
deal
soit
with water
au
hygiene
cœur
and
de
sanitation.
la lutte contre la
That
pauvreté.
has to be at the heart of
Et
the fight against
j'aimerais
poverty.
dire une petite anecdote à
Just as a short
Monsieur le Président,
aside,
l'ancien président,
for the
et
former
mon président
president,
actuel, au cours de sa
our
campagne
current president in the
électorale,
presidential
quand il
campaign,
part dans les campagnes, quand il
when he
traverse
was
les villages,
out going down
les
to the
populations, qu'est-ce
villages,
qu'elles lui disent?
speaking to people,
Ils
what did
disent,
people
nous, on veut
say?
de l'eau.
They said, we
Les gens
want
ne demandent
water.
pas des centres de
People
santé, ils ne demandent pas
don't ask for
des
health.
écoles, ils ne
They
demandent
don't
pas
ask for health centers or new schools
des équipements de ceci,
or
ça.
specific
Ils disent
equipment. What they want is
Donc,
water. What
l'accès
they
à l'eau,
need is
vous avez
water.
parlé beaucoup de
Access
qualité
to
de l'eau.
water. You
Nous,
talked
c'est
about
même
the
l'accès
quality
qui est
of
le
water. We're
problème.
not even dealing with
Donc,
quality. We're just
l'accès
dealing
à
with
l'eau,
access at the
oui,
moment. So
l'accès
So
accès à
access
l'eau
to
de
water,
qualité.
access
Oui.
to quality water, of
Et
course, but
une fois
access
que
to
ce
water
problème
first
d'accès à
and
l'eau,
foremost.
il faut
And
le
once
voir de
we've
manière
dealt with
aussi,
that issue of
je
access
dirais,
to
transversale.
water, and again, you have to deal
La
with this
question,
on
il
a
ne faut pas
fully
voir
horizontal basis. You
simplement
can't
l'accès à
just
l'eau.
think about this as access
Au
to
Niger,
water. In
l'étude a prouvé
Niger,
que
the survey that we've
c'est
done
vraiment,
has
il y a une
shown
corrélation
that
étroite
there's a tight
entre la
link up
malnutrition,
between
l'eau
malnutrition,
et l'assainissement.
water, and
Et
water hygiene
nous
and
sommes partis
sanitation.
dans les études que nous avons faites, nous
we've
avons même
done
constaté
a
que
number
même
of
le niveau
surveys, and we've
d'éducation
seen that in
du
that
chef de
context,
famille joue sur la
even the
nutrition
level of
des
education of
enfants.
the head of the
Ainsi de suite.
family has an
Donc, tous ces
impact on the
points-là
education
seront
of the children.
adressés
So
avec
all
ce
of
que nous
this
appelons
has to be
la
tackled
transformation du monde
with
rural.
the world,
Cette transformation
the
du monde
rural
rural,
transformation
il y a le
that
capital
we're
humain
trying
qui est
to
adressé.
instate, and
Il y
that
a-
deals
il y
with
a- il y a
human
l'autonomisation des
capital,
femmes
that deals
qui
with
joue.
women's empowerment,
Parce que
because
les
that
femmes
comes in
sont
and plays
les
an
premiers
important
facteurs.
role as well. Women
Donc même
are,
leur grossesse, le
the
suivi
first
même de
to
leur
bear the
grossesse, parce
brunt
qu'on
of
peut
this
avoir
in
un
terms of
enfant
their
malnutri dans la
pregnancy as
naissance.
well, because you can have
Donc,
a malnourished
parce que la
child
mère
as
est
of
malnutrie.
birth because the mother's
Ainsi de
already
suite. Donc, c'est
malnourished, and
toutes
so
ces
on and
questions-là
so forth.
que
So
nous
all
voulons,
of these questions have to be dealt with.
comment dirais-je,
I think that
examiner
in
autour
that
des pôles.
sense, we have to
Nous avons
look at
créé
how
8 pôles
we've dealt
pour
with these
suivre la mise en
different
œuvre
hubs
avec
to
des
follow and
les
monitor
ODD,
what we're
nous les avons
doing.
transcrits
We've got the SDGs, and
donc
we've
dans notre
actually
en cible, dans notre plan de développement économique
instated
social,
them in
et nous
our
allons les suivre tous les 3
PDES,
mois.
and so we're going
Tous
to
les 3
do
mois, quels sont
3
les progrès
monthly
que nous faisons
follow-ups to
et
see
comment
how
il
we're
faut
making
redresser la
progress on
situation.
this, how we can
Et évidemment,
redress the
la
situation,
coordination
and how we can
intersectorielle
ensure
est au
intersectorial
cœur
coordination,
du
because
problème.
again, that's at
Et
the
vraiment, je
heart of the
remercie
problem. And I
la Banque
really
mondiale
want to
pour
thank
avoir
the
mis
World
le doigt
Bank for
sur le
really
problème.
having put
Et
their
ça nous
finger
interpelle,
on
je vous dis.
where it hurts. I mean, this
Moi, j'ai
really
pris
speaks to
beaucoup
us.
conscience en
I
lisant
was
ce document-là.
really,
ce
my
qui
awareness
concerne le
was
Niger.
raised when I looked
Et
at this
le
document
ministre
and the
délégué
results on
obligé est là.
Niger, and
Il a
the
écouté sa
delegated
collègue
ministries are
des
there.
finances
And
d'Indonésie.
the
Je
Ministry
pense
of
que
Finance is
quand nous
here
allons
as well
retourner,
from
nous
Niger
allons
and has heard what the
avoir du
Ministry from
boulot à faire
Minister
avec nos
of
collègues
Indonesia
de
said, and I'm
l'hydraulique, de
sure
la santé,
that
de
we'll be
l'éducation,
able
de
to
l'agriculture, de l'élevage,
deal
etc.,
with
etc.
all these
Merci
different
beaucoup.
aspects. Thank you very much. Thank you.
Thank you. Thank you so much. So, I'm going to turn now to you, Bella. And the question I'm going to ask you is probably not directly related immediately to what to the countries that you are the country director of, but your previous experience as well. So you have had considerable experience in fragile countries and in conflict-ridden areas. We know that levels of malnutrition are particularly exacerbated in times of conflict and in fragile states. They also present huge challenges to actually do something about. Can you share with us some of your thoughts on fragility and the ways in which malnutrition and fragility intersect?
It's working. Okay, well, thank you very much to Guang and colleagues for setting up this panel on this critical issue. I think I work across 4 countries at the moment. You mentioned Tanzania, Burundi, Malawi, and Somalia, and a mix of stable and fragile, and the differences between them are quite. There are a lot of similarities, but there are a lot of stark differences as well. And as you say, I've worked in a mix of countries in the past. Where I would say that across our clients, the reaction that we've had to the growing data on the importance of the early years, the first 1,000 days, is exactly what was articulated by Madame Minister just now. It's like the scales have fallen from our eyes. We knew there was a problem, but now we're really seeing the significance of the problem and the implications of the problem. And also the complexities of actually tackling the problem because of the multi-strands that need to come together in order to fix it. Now, in countries such as Tanzania and Malawi, which are the countries that are stable in my current unit, and what we see is a big focus now on the institutional mechanisms of leadership and coordination at the top level and also at the community level, with accountability mechanisms built in. And we're at the early days of designing our interventions, our scale up in this area, but we do have experience in Malawi which has shown the role of the chief at the local level, for example, in being held to account for the delivery of the integrated set of interventions on nutrition through what they call care groups at the community level. and in Tanzania, they're looking at finding their own mechanism. When it comes to the more fragile countries, and of the two that are in my current portfolio, Somalia and Burundi, with Somalia don't even have data yet, but we know when we have data, we're going to see the extent of the problem, no question. I mean, they've just narrowly avoided a famine this year. But we have to get them into IDA first, so we're working on that. Then we can have the resources to respond. But with Burundi, with a country like Burundi or other fragile states, it's more complex because of the institutional issues, and you don't have a framework. You don't have the core of a fragile state is that the institutions are not functioning in the way that they are in more stable environments. So looking at that, where do we start in Burundi? And to be honest, we've scratched our heads a bit, but and we haven't found the solutions. But some of the projects that I've overseen as a country director in places like South Sudan and Burundi, that work, focus on P4R, PBF, what we call performance-based financing. And often through third parties. And I think in fragile states, when your state structure is a little unstable or perhaps not operating to the level that you need for delivery of such a relatively complex program, you have to look to where the capacity is. And often it's usually in the third sector. Sometimes in the private sector, not often. In Somalia, you'd find it in the private sector, interestingly. But in many cases you don't. But you do find it in the third sector, the charities, the agencies, the NGOs, the UN. And there, what the kind of ideas we're looking at in Burundi are what I've seen in health. Actually, the most successful programs I've ever seen at delivering in fragile states are PBF programs with very clear DLIs. Terminology that we use, disbursement level indicators around key health results. And we saw in South Sudan, for example, through the conflict that started in 2013, the only program in our portfolio that kept running in the conflict-affected area was a performance-based financing in health, which actually had hired an established NGO to deliver on key DLIs, key performance indicators, in conjunction with the services such as they existed, and they were very limited at the local level. So you kept that interface with services, and you also had the ministry in a coordinating role, but you had the mechanism done through the partner agency. We've got a similar approach in Burundi on basic health, which is astonishing. Again, through a very unstable period in the country, it continues to be able to deliver in a partnership between the public sector and the third sector, the charitable sector, some really stunning results at basic health at the local level. So this is one example, but I think it's got some of the core elements that we need to be looking at. But I said this morning at a panel that we were at with country directors and Keith Hansen, this is an area where we need to really collect examples of what could work and adapt them to this particular problem. Thanks.
Thank you very much. Rashid, so you are the country director in Nigeria, and clearly it's a heavyweight, of course, in Africa, but it's also a country that has, just in terms of absolute numbers, it has probably the largest number of kids, third largest number of kids globally in terms of absolute numbers that are stunted. Over 41% of kids under the age of 5 in Nigeria are stunted. Could you share some of your experiences in a country, again, as diverse as Nigeria? What are the kinds of things that we are doing and we could be doing more of? From the bank side, but also broadly from the development community.
Yeah, thank you very much for the invitation. I work on Nigeria. It's not one country only, but it's one federal government and 36 states, and each of the states have their own ministries, and therefore we have a multiplicity of clients. We have just the most recent health survey just about a month ago shows that Nigeria is basically the worst place in West Africa to be a poor child or a mother. And that's really serious. And Nigeria's development challenges, together with a very explosive demographics, is going to pose not only a serious challenge for Nigeria, but it's not going to stay in the border of Nigeria. So therefore, I will spare you all the statistics. So therefore, there is a sense of urgency. So the way that we did it is to basically tackle the problem by first engage in a policy dialogue where we put the analytical work at the forefront and bring the evidence around the social cost of malnutrition. We then embarked into a process of engaging with a range of stakeholders at all levels to really build a coalition around the sense of urgency, but also around some reform champion. And then we moved into a process of formulating a reform plan, but with implementation. But we also then decided that the best instruments is it has to bring a performance-based financing. So we have a number of performance-based financing in our program. So the approach to stunting, we have taken it in a very comprehensive way through the lens of investing in the early years. And we have multiple programs that address social safety net programs, a better education for all. We have more than 30.5 million out-of-school children in Nigeria, the largest in the world. We have a program for eradicating polio, because still Nigeria is among the 2 countries in the world where polio is a problem. We have a large program of performance-based lending on saving 1 million lives, which deals with the child and the mother. And we have an important program on women empowerment, because we felt that one activities will not be able to solve this problem. So we have to tackle it through a multi-sectoral program, because the challenge is that there is a fragmentation. There is a fragmentation in the government system for the basic service delivery. So therefore, we need to be much more coordinated in actually responding to 3 things. One is the child welfare. Second, the mother's health. And third, the economic empowerment of women, because these are all interrelated issues that if they're not addressed together, we will not solve the problem. And we also know that there is a clear link between these problems with poverty in Nigeria. And we know that without addressing those issues, poverty in Nigeria will not be reduced, and poverty in Africa will not be reduced, because if you want to make progress in poverty in Africa, you need to start with Nigeria, where you have more than 110 million people living below the poverty line. So just to give you my experience, when over the last 2 years, when I became the country director of Nigeria, over 2 years I met about 24 governors of states on a 3 hours, 4 hours meeting about discussing their issues. And surprisingly, none of the governors has asked me, we need a water program. They talked about education, they talked about health, and I asked our colleagues, what have you done over the last 2 years? I say, okay, is water not an issue? And we didn't have a rural water project or sanitation project in the portfolio period. Does it mean that it was not an issue? So what they decided is that let's do a deep dive on the water sector problems. And I think really this engagement through the WASH has really been a blessing, because we really brought forward the issue of water, sanitation and hygiene and the link to the poverty. And through this diagnostic, we have achieved 3 things. First, we confirmed that what everybody knew, that water and sanitation in Nigeria is in deep trouble, and that we provided the evidence for it. The second, we helped increase this awareness around the crisis, and this is why the water diagnostic report was called a wake-up call. And we really built that we initiated to build the coalition around the crisis. And this coalition is still a work in progress, but we need to sustain it. The third, 10 days ago, the Vice President of Nigeria actually launched the wash diagnostic. And it doesn't happen that often that the Vice President take the time to come and spend an hour and actually launch the program. And he called for action to all the state government to come back to him with an action plan. And then he asked me that I can come to see him 3 days later on a national holiday to have a follow-up. So it was a 40-minute one-on-one meeting where he has said that we need to embark in a follow-up action, both at the federal government as well as the state government. So the plan is we are going to have this action presented and prepared by the state government and the federal government, and we will provide the support as a bank to help that. Then the plan will be presented at the National Executive Council, which is the council that is chaired by the Vice President and involve all the state governors. So therefore, because they are the ones who are responsible for implementation of many of the social programs, including the programs on the water. And then we are going to, they are going to present it to the Federal Executive Council, which is chaired by the President of Nigeria, which is the member of the cabinet. So we have a lot of work before us. And the proposal is to make sure that this is going to be done in order to inform the 2018 budget. So what we are contemplating is putting together a challenge fund that is going to be led by the federal government to provide exactly the kind of incentives at the state level for implementing reforms, but also to incentivize a faster pace of changes. So we want to see the slogan is going to be smarter money, more money. Thank you.
Thank you very much. Thank you. This is thank you. We have a really short amount of time, but I do want to hear from the audience. Maybe the first 3 people that I see can ask a question. So could you? So I have a hand up there.
Hello.
Please introduce yourself.
Hello, my name is Xia Hui Ho. I'm a senior economist in health, nutrition, and population practice. So I just want to share from the task team's perspective regarding collaboration with other practice in the country. And this is in Papua New Guinea, a country with a 7 million population, very decentralized with 22 province and 99 districts, with a stunting rate at 46%. So we collaborated with the agriculture practice in terms of having a nutrition component in the project. The few challenges I just want to share, so maybe you can draw attention from senior management. I'll be very short. One is the project location. Like often we have location for different practice in different districts. And second, regarding financing, because any financing which was supposed to use in agriculture now need to divert it into nutrition or health related, and that need a bit of the convincing argument and evidence. And the third is also the monitoring and evaluation in terms of putting nutrition-related indicators into the project, and we have the experience know that is also have the challenges to have additional indicator to make sure that can be accurately and timely collected. But with all those challenges, I think we always find the solutions, but it wasn't an easy, easy try. So from task team wise, I think we often need more collaboration, but also from the county director as well as senior director level, I think more guidance and more enforcement is required. I think think it's truly worth all the effort. Over. Thank you.
Thank you so much, Shelby. We can have two more over on that side. Please introduce yourself.
Thank you. My name is Megan Wilson, and I work for Meditech. It's a producer of Aquatabs. My question is for Madame la Ministre, and I'm going to speak in French if that's okay, everyone. Madame la Ministre, j'ai beaucoup apprécié
Madam Minister, I really appreciated your comments. Thank you very much. And your call to action. That is so important. That call to action to make sure that everyone has access to water. What are the main challenges to ensure that everyone has access to quality drinking water? And what can we do to help you? Thank you.
We'll take one more, and then I will.
Hi, my name is Rita Rahman. I'm from Bangladesh, and I know the panel, but in the papers presented, Bangladesh was mentioned, and the E. coli and the water sanitation and situation in Bangladesh is a very well-known issue to the World Bank people, especially who are working with WASH. So I just want to, there are two things that was bothering me. One is in Bangladesh, the implementation procedures, the institutional duplicities, I would say, in terms of implementing some of the policies that are taken, the projects that are ongoing. The thing is that the implementation rate and the visualization of successes brings a lot of questions to us. What we find is the lack of inclusiveness, but I don't know if this is an appropriate question to be placed here in this panel, but I just, perhaps for your acknowledgement, I just wanted to mention. Thank you.
Thank you very much. Okay, maybe we'll do one more, and then I'll just have to hand it to the panel for the last word.
Yeah, my name is Harold Lockwood. I work for Ag Consult in the UK, and it's been a very interesting discussion and debate. One of the things that we're finding in our work is that we come up against this political economy, and I think it's no good really talking only to the technocrats. We have to go up another level, and I was very interested to hear some of the comments, particularly by the minister from Niger. We know of some other good examples, promising examples in other countries like Ethiopia, but how can we do more to reach those political decision makers? I mean, particularly for those of us who are not the World Bank.
Thank you. Thank you so much. I think we're going to stop for as far as the questions and comments are concerned and hand it over back to the panel. Let me start with you, Madam Minister, just in terms of one of the questions was specifically addressed to you, and also a second one. So if you could just share some of your thoughts.
Merci beaucoup. Merci, Madame, pour votre question.
Thank you. Thank you for your question, and thank you to the others for their comments. More contributions to this discussion. There's one word you said, one sentence I heard earlier, and maybe it wasn't noticed, but someone mentioned a silent emergency. You can't have silent emergencies anymore. It has to be a noisy emergency. It's an emergency, and people need to know about it. It has to be lousy. It has to be absolutely noisy. And if we want it to be noisy, we need to be able to act. And what you were saying, when I talked about rural areas, the big problem is access to water. And we see that issue from a point of view of funding. That's really the big issue. In Niger, what the study showed was that we have more access to water in urban areas than in rural areas. And we want that to change. We want access to water and to drinking water in rural areas to be something that is a reality. It's an objective for us, and it's something that we're committed to. This is why, as part of the emergency plan, we're going to be listening to you. We're going to be announcing funding for villages. We need to solve the water issue, but we have to solve that and the energy problem at the same time. If you have water, but you don't have energy, well, then it's another list of problems. If you have water in a village and you have a health center where women give birth, for example, if there's no hot water and no electricity, well, you have no hygiene, so still more problems. So we need water, but we need energy. Access to water. I think we have enough sun. And access to electricity in rural areas is 0.7. So that we have a number of challenges, one of which is security, which also has an impact. We have refugees that bring their own problems. And we recently had an epidemic of hepatitis, which was brought in by refugees from seeking refuge from Boko Haram. So that's something I was adding in parenthesis. So what we need more than anything is funding. We're confronted with a number of challenges: security, climate change, raw materials, and the needs are there. In order to achieve human development, basic human development, and we need huge investments, especially for rural areas. Water and energy, and the two at the same time. The rest will follow.
The political economy of this.
Yeah, I didn't actually fully understand that question. What were you asking? How to have contact with us? I didn't quite understand.
There's no point in technocrats just talking to each other when some of the problems are inherently political. So how do you create political coalitions around this issue?
Well, I think that the country director from Nigeria gave an excellent example. So, if you take the example of Nigeria for awareness raising, in terms of the political coalition, you shouldn't just think of governments, you should think about political commitment by the whole nation, and actually not just political in the political sense of the word, but politics includes people, includes civil society. When I was saying that the candidate, when he was running his election campaign and he went to see people in the villages, they said in Nigeria we want education and health, but in my country they said we want access to water. So you have to hear the will of the people, you have to hear what the people say. They have representatives which enable that voice to be heard. So yes, you do have to build that kind of coalition on a national level and on a regional level as well. In fact, sometimes these are issues that have to be resolved through regional integration structures, through sub-regional integration. If you look at what's happening in Nigeria, if you haven't eradicated polio in Nigeria, then we're also still threatened by polio in Niger. So that's the kind of collective thinking that we have to come up with. It has to be national political will, but it has to involve everyone getting onto the bandwagon. Political parties, the government, MPs, parliamentarians, they have an essential role to play as well. Everyone has to be committed. Anyway, that's my promise. I'm determined to do this in my country. With my colleague from the budget, we're going to try and trigger this mechanism, because it's an issue. Today, we're not going to reach our objectives if we haven't dealt with that and tackled that issue first and foremost. We need to fulfill our objectives in that regard. And I hope that we'll get the funding to be able to do so. Thank you.
Thank you so much. So, Guang, before we get thrown out of this room, just sort of a takeaway from you. What are we going to do differently?
Okay, well,
Thank you very much for all these comments and suggestions and also reflections. I think I'm not going to say too much. I thought I already presented a lot of talk about how we're going to work differently. And I already highlighted the fact that we're already doing that. And I think there was some specific question about how we can sustain this sort of high level within the bank from the senior management, from directors, senior directors. And I think that panel showing up here is a good example of that, because it's not just about one GP, but also working with the country directors. They also have a key role to play in influencing that behavior change. And we can see that the result of that, and we can certainly commit it. I think, Madam, you raised the question about inclusiveness. In fact, this is actually one of the thematic areas under the water GP. I mean, we'll find one of those is financing. We don't have time to get into the detail of that, but this is certainly one of the high priority. In fact, Maitri is our focal person on this inclusive agenda. It's not just about gender inclusivity. The study itself highlighted the fact about the urban and rural divide. When talk about inclusiveness, those are the challenges that we have to tackle. So I think this whole exercise for this group, I'm sure we're already convinced, but I think we need to reach out to others that are not necessarily as so convinced of the work that we do, and we have to sustain that effort.
So thank you. We still have people here, and I'm going to still maybe ask Bella and Rashid very quickly if you had any final thoughts that you couldn't share at the time and really are dying to do so now.
Very quickly, I just want to acknowledge the comments from the task team. I think there are institutional issues internally that we need to sort out to make life easier for you, and I think that you should come up with. I would encourage you to come up with concrete suggestions for how we do it, because we're all open to hearing how we can do that. And then I just wanted to finally acknowledge the WASH diagnostic that you mentioned, Guang, and just say that in Tanzania we've got a map, and I think I've got it here. I wish I'd had it to put up on the screen, very tiny here for you, but it basically maps the sanitation indicators alongside the poverty indicators across Tanzania, and it shows a very strong correlation between the two. And now the team are putting on the nutrition indicators, and of course the correlation is there as well. And this will help us to geographically target the combination of interventions that are required to really tackle this. And I just wanted to say thanks to the Watsan team for this, because it's really operationally useful. Thanks.
Thank you. Rashid, anything?
Just briefly, I think I could say that Nigeria being the largest economy in Africa, the size of the government is still small. It represents only 5% of the entire economy. And when you take 50% of that goes to reimburse for the interest rate on the debt, you are not left with too much to do to do a lot of things on the development challenges. So you could see that really the importance is solving, of course, the problems in the sector, but domestic revenue mobilization is at the heart of solving the problems, because the country, many people just do not pay tax. Out of 180 million people, less than 700, 800,000 are actually paying taxes. So the country just cannot survive without that. Second thing, the country is 95% private sector. So and there is a large informal sector. So the private sector has to be part of the solution. So working not only with the SDHD, but we have to work with our MFM colleague, but also work with the IMF colleague on all the issues related to revenue mobilization, tax administration, and so on. It's going to be a critical part of the problem. We can diagnose the problem, we can try to find the solutions, but at the end of the day, we have to pay for it. Because whatever we do as a bank, a group, and all the development partners together will not represent less than 0.5% of the GDP in Nigeria. So our role is going to be catalytic to actually make that change.
I just wanted to thank Professor Turk. Thank you so much. And it really seems as though the idea of financing and different types of financing at the local level, at the national level, at the international, has been an ongoing thread in this panel, and you brought that out as well in your presentation. So just wanted to thank the audience, because I know that there are several other places you could have been, but you're here, and you've stayed well beyond our 12 o'clock mark. So thank you very much. This is going to be an ongoing conversation. Please stay engaged. Thank you.